त्यातील काही सेवा ह्या फार्मसीतर्फे असतात, तर काही कॅनेडियन हेल्थ सर्व्हिसेसचे फार्मसिस्टच्या तर्फे राबवलेल्या असतात. अशा सर्वच उपयुक्त गोष्टींची आपल्याला कधी-कधी माहिती नसल्यामुळे आपण त्यांचा लाभ घेऊ शकत नाही. भारतातून नवीन कामानिमित्त किंवा इमिग्रेशन घेऊन इथे आलेले किंवा इव्हन भरपूर वर्ष इथे राहिलेल्या लोकांनाही नवीन-नवीन झालेले चेंजेस कधी-कधी माहिती नसतात. त्यामुळे आजच्या आपल्या ह्या चर्चेचा सगळ्यांना खूप फायदा होईल अशी माझी खात्री आहे. तर आजचे जे टॉपिक्स आपण कव्हर करणार आहोत, त्याची माहिती आपण ईमेल तर्फे सगळ्यांना पाठवलीच आहे. तर मला असं संतोषला पहिल्यांदा विचारायचंय, की आपण जेव्हा भारतातून इथं येतो संतोष, तेव्हा आणि जेव्हा आपण फार्मसीमध्ये पहिल्यांदा जातो आणि प्रिस्क्रिप्शन घेऊन जातो, तेव्हा असं दिसून येतं, की प्रिस्क्रिप्शन फिलअप लगेच होत नाही. आपल्याला 20 ते 30 मिनिटं थांबावं लागतं. कधी-कधी दुसऱ्या दिवशी येण्यासाठी सांगतात. असं का? तर आपण भारतामध्ये गेलो, की आपल्या समोर लगेचच ते आपल्या औषधं हजर असतात. तर ते कशामुळे आहे ते तू जरा समजावून सांगशील का सगळ्यांना?
Absolutely, Pallavi. First of all, I would like to thank you, Pallavi, for introduction and for kind words. Really appreciate it. And I would like to thank you, Prashant, and all board members for giving me opportunity to share my knowledge and experience with everyone. It's pleasure to see everyone here. And I'll try my best to make this session informative, illustrious, and impactful as the name suggests. I3Quest. I really like the name I3Quest, very catchy, and hopefully, everyone will enjoy it. My session. So we'll start with the questions which you asked, and it's often time this question is asked by my friends as well. So let's look at it. Why it takes a while to fill the prescription or to get the prescription here, and what are the steps involved in that. Okay,
हं.
so it's basically we'll talk about basics of pharmacies, how community pharmacies in Canada operate, and what is a pharmanet operation. So let me play one scenario wherein somebody walking into the pharmacy with a new prescription. So whenever we receive a new prescription, what we do is there are certain steps involved. So first step is we identify the client. We make sure that the prescription is matching with their identification. We ask them their health card number, and then after that we check their demographic information, like address, phone number, allergy information, and if they have any extended healthcare or a private plan which covers the cost of medication.
हं,
Then we create a profile for them, and then after we create a profile, what we do is we input all the information from the prescription in our computer software. Okay, while entering the information, we also ensure that the prescription is written correctly. The name of medication is there, strength is there, a direction for use is there, quantity is written on the prescription. Doctor has signed the prescription. Also, the prescription is not expired because it's the validity of the prescription is for 1 year from the date prescriber write the prescription. And then after checking all this information, we enter that information in our computer system. Now, now the most important part comes, which is Pharmanet. Let me tell you, Pallavi, we
हं.
are very fortunate and lucky that we have a Pharmanet in our province. Not all provinces in Canada has a Pharmanet. Most of them they have it. So what Pharmanet is when we enter the prescription in our computer system, we get connected to a Pharmanet,
हं.
which is a province-wide network which links all BC pharmacies to a central data system where all the prescriptions are processed. Now, the beauty of the Pharmanet is pharmacists get access to clients' history, what prescriptions they have filled in last 14 months. It doesn't matter from where, which pharmacy they filled, as long as it is filled in BC, then we have access to it. Now, that access really helps to make sure that the new prescription which is dispensed is correct, it's safe to use, right? And if there is any concern, we address those concerns right there. Like say, for example, if a client walks in with a new prescription, okay, and it's the first time they will be using that prescription, okay, and what happens, like they are already using some other prescriptions, and the new prescription which we received is, if it is, for example, interacting with the existing prescriptions, then we stop right there. We check the interaction, right? And sometimes the interaction may be fatal. Like, for example, client, uh, I'll tell you like a couple examples. Client is taking one medication, theophylline, and the prescription is for antibiotic ciprofloxacin. So the interaction is a major interaction which might leads to further consequences, right? So there we stop it. Or a simple sometime interaction, like client is taking common medication like for high cholesterol, and the prescription is for antibiotic, for example Viaxin, and that medication the interaction could be dangerous, right? Or the client may handle it, but what we do is we intervene right there. We inform client that there's an interaction between the new medication, and there are various ways we can handle this, address this. First is, if possible, if we can take our own decision and it tells us that it's okay, we're professionally, we checked everything, right? So we can even request client to stop the high cholesterol medication for 7 days if this the course of the antibiotic is for 7 days, or reduce the dose, and we notify the physician that this is the decision we have taken. In case if the physician has any concern, they will fax us back or they will call us to clarify. Or in most cases, what we do is before taking the decision, we will contact physician, will inform the physician that this is the interaction, right? And it may not be safe for this client to take this medication. They will check their database, their history, and they will get back to us. Also, sometime, and this is a very common mistake happens, that client is taking, for example, a diabetes medication, metformin. Now, earlier dose for metformin on the Pharmanet is, say, for example, 2 tablets twice a day. And the new prescription says 1 tablet twice a day. Then it could be intentional change or it could be a mistake, right? So in that situation, right away, we will talk to client, will inform him that, are you aware of the change in the dose, right? If they say, yes, we are aware, then it's fine. But if they are not, then we will clarify with physician, okay, either through fax or through phone, right? That way, the client, we ensure that the client gets the right dose, right medication, right? And there is no another problem which will lead after taking the medication or changing the dose, right? Because sometimes it is very important, especially, for example, if the client is taking diabetes medication 1 tablet twice a day, and now the new prescription says 2 tablets twice a day, and the client is not aware. Now, it could be high dose for them, and it might lead to hypoglycemia, low blood sugar. Client might fall down, might lead to further complications, right? So that's why the Pharmanet checking is very important, and it takes a little bit of time for us to check.
म्हणजे तुम्ही
But some
पेशंटची सगळी हिस्ट्री बघून ठरवता, की आता हे बरोबर डोस आहेत की नाही, किंवा चूक झाली आहे का डोस प्रिस्क्राईब
absolutely.
करताना, हे सगळं तुम्ही नक्की करून त्यांना देता.
Yes, that's, and sometime, say for example, client has chronic kidney disease, okay, their creatinine clearance is very low, and certain medication dose need to be adjusted then, situations like that. It's not only the drug interaction, it could be a drug disease interaction, right? Or it could be like, you have to make the adjustment to the dose, so it's okay for them to continue taking that medication safely, right? And in situations like that, the beauty is because we have such an amazing system that if accidentally doctors make any mistake, a pharmacist can catch it,
Yeah.
right? Or if something, the new doctor is not aware, right? The pharmacist can say that this is what it is right now, they're taking this, or they have this medical condition, right? Please clarify. Or sometimes some client goes to walk-in clinic, and sometimes they don't check the pharmanet profile, and the mistake may happen, right? And there is another check there, right? So that's why we check thoroughly the pharmanet.
Mhm.
After pharmanet check is done, then we will make the prescription ready. Like our technicians, they will work on it, they will check everything, and then pharmacists will check thoroughly as per the prescription. And the next step, a very important step, is counseling. um, so if the patient is taking medication before, has taken before, the counseling may not be thorough counseling, because they are aware of how to take it. They are aware of the side effects. They are aware of, how it affects, right? But
Mhm.
if it is a new medication, then we ensure that client understands how to take medications, why they are taking this medication, what are the common effects they will experience, how
Mhm.
to manage those common side effects if they experience it, in case if they miss the dose, what they need to look for, and we'll brief about if there is any specific instructions or precautions they have to take as well while taking this medication.
Mhm.
Also, if required, then we will print the information sheet and share with them, to ensure that they, if they have any question in future, they can get back to us or clarify. It's always good idea to take an informed decision, right, than going through any concern later, right?
Okay.
uh,
Right.
so that's the reason it takes a little bit of time to
Yes.
dispense the medication. It's for client
It's
safety.
worth spending that much time for
Absolutely,
getting
absolutely,
like,
right?
yeah.
And we found these mistakes, and sometimes these mistakes have a really, really bad repercussion, right?
Yeah.
And that's where the pharmacist plays important role.
हं.
So
तर
that's about the basics of the pharmacy.
हं. आता तू मला एक सांग, की फेअर फार्माकेअर हा प्रोग्राम जो ब्रिटिश कोलंबिया गव्हर्नमेंटनी 2003 साली चालू केला. असा सगळ्यांचा समज आहे, की हा प्रोग्राम अशा लोकांकरता आहे, की ज्यांच्याकडे एक्सटेंडेड हेल्थ कव्हरेज नाहीये. तर असं असताना सगळ्यांनी सरसकट या प्रोग्राममध्ये एनरोल होण्याची गरज आहे का?
Well, it's a very good question, Pallavi. You
हं.
asked. Let me acknowledge this question. What Pallavi is saying, is asking is, do we really need to know about fair pharmacare? Like, let me briefly tell you what it is. Okay, let me quickly share the next slide with you guys. So, registration with fair pharmacare and special authorization of medication. So right now, we will talk about a registration with Fair Pharmacare. And this is extremely important. Actually, all residents of BC has to actually register with Fair Pharmacare at some point. I mean, sooner is better, right?
हं,
The reason being is, why you need to register with Fair Pharmacare. So Fair Pharmacare actually help reduce your cost of medication, and it's totally based on your income. The If your income, family income is low, then the pharmacare kicks in. Fair pharmacare, they may cover the cost of medication, which a lot of people, they are not aware. Like oftentimes, this information is not shared, especially with newcomers, especially with with seniors. Sometime, like after their retirement, sometimes their income drops, or when the newcomer are arriving in Canada, after 3 months they will be eligible for MSP coverage, and they are in the process of settling down their families, right? So they have a lot of other expenses, and if they are taking some medications which are expensive, right?
हं,
If they are aware of this program, that if they registered with Fair Pharmacare and if they fulfill the criteria needed, they may be eligible for coverage right from the beginning, right? It could be, pharmacare might pay a 75% of the 70% of the cost, or they make pharmacare may cover even 100%,
100%. येस.
right? And there is a information there, like it says health insurance BC contact information, and there is a link also to register with Fair Pharmacare. I believe most people here connected, they are registered with Fair Pharmacare, especially if you know that, if your medications are covered by Pharmacare, means you are registered. But if you are not, then it's a good idea to check your status by logging in online. You will need your health card number, you will need your date of birth, and then you would know if you and your family is registered with Fair Pharmacare, right? And if you're not, then it's good idea to register. That's
आपण एक दुसरा विचार के बोललो होतो, की
yes,
जर एखादा पर्सन इज वर्किंग अँड ही हॅज एक्सटेंडेड हेल्थ,
yeah,
बट मध्येच वर्षाच्या मध्येच जर त्या माणसाचा जॉब गेला आणि EI वर गेला, तर
yes.
त्या माणसाला ही हॅज टू कॉल देम अँड टेल देम दॅट हिज इन्कम हॅज कम डाउन सबस्टन्शियली, सो ही शुड बी covered by pharmacare, right? That is what
Absolutely,
we.
absolutely. This is very important.
It doesn't happen automatically sometimes, right?
Yeah, exactly. So, if you get a layoff, or, if you plan to start your own business, like you're working several years, now you decided to open your business, and sometimes it takes a while for your business to actually start working for you, right? And during that time, you might need some help for covering the medications, because you're probably spending your time on the business or investing, right? Or during layoff, you might need some help with the coverage of your medication. Then in that situation, if you call the number which is posted there, and you explain them that, this is the situation, current situation, is Pharmacare covering my cost of medication? They're very good. They will guide, they will tell that, what you need to do, right? um, if you're not eligible right now, it could be that down the road, after 3 months, after 6 months, you will be eligible, right? But at least if you're aware, then you can take those steps, right?
Mm.
And that's the reason I'm requesting actually everyone that they should register with Fair Pharmacare, regardless whether their medications are covered or not. The reason being is, once you're registered, then it is indefinite. You don't have to re-register yourself, as long as you're filing your taxes, income tax, regularly. Okay, because when to decide whether you are eligible for coverage or not, Fair Pharmacare will they have access to CRA information, like your income tax, basically, like how much income you're making, and based on that, they make a decision whether you're eligible for coverage or not, right?
Mm.
Also, one more quick thing, oftentimes, if you have extended healthcare, people, they are not aware if they are registered or not, because their medication cost is covered. But at some point, even extended healthcare, they right away send the messages to us when we send the claim to them, that please inform client to register with Fair Pharmacare and share the registration information. And if they do not do that, at some point they may even stop the coverage. And it happened in the past with some of my clients, that the coverage has stopped, and then they have to really rush, register themselves, and then after that give the information to the extended healthcare, and then their coverage is back in track, right? So it's a good idea to do it regardless.
सगळ्यांनी रजिस्ट्रेशन करणं करणं गरजेचं आहे. काही ना काही कारणाने त्यांना त्यांना गरज येऊ शकते, किंवा
Yes,
मग एक्सटेंड हेल्थ पण कधी-कधी कव्हर करणार नाही तुमचं मेडिकेशन, जर तुम्ही रजिस्टर्ड
absolutely.
नसाल तर.
Yeah,
आता
yeah.
एक गोष्ट आहे, ते तू म्हटलं होतं स्पेशल ऑथरायझेशन.
Yes,
ते
yes.
एखाद्या मेडिकेशनसाठी जर स्पेशल ऑथरायझेशन मिळवायचं असेल, तर
Yeah.
त्यासाठी फार्मसिस्ट काही हेल्प करू शकतो का? आणि फिजिशियन आणि फार्मसिस्ट मिळून आपल्याला कसं ते मिळवून देऊ शकतात? तर
Yeah,
त्याच्याबद्दल सांगशील का तू जरा?
definitely. So let me share with you what is a special authorization. Um, so special authorization is basically, it helps grant coverage to certain drugs and medical supply or device. Okay.
हं,
Um, so certain medications are very expensive medication. Pharmacare or extended healthcare, they may not cover those medication right away.
हं.
Okay, they need a special authority. It's a special approval, uh, and the process is very simple, easy. All the physician has to do is they have to fill out one form, explain why this client needs this medication, are they meeting the criteria, Like we'll take one example. I'm sure all of you must have heard about one medication, warfarin.
Mm,
Warfarin is a blood thinner, very commonly used. Pharmacare, most extended healthcare, they cover that medication. But sometimes, for warfarin, you really have to monitor. You have to monitor INR. You have to visit the lab uh, very often. Sometimes some clients, they cannot do that, or they experience side effect. They get um, bleeding and stuff. So sometimes then the doctor make a decision of changing that medication to a newer kind of blood thinners, which are expensive. The cost of newer blood thinners like Xarelto or Eliquis is around $300 for 3 months. So it's quite expensive for some clients, right? And
mm,
especially if they can avail that benefit through extended healthcare or through pharmacare, why not, right? So in that situation, what we do is we request physician to apply for a special authority, or in certain cases we are as a pharmacist allowed to initiate that process. If we know the history of the client, if we know everything, right, then we will make a letter to the pharmacare explaining why this client needs this medication, and the special authority should be approved for this client. In most cases, pharmacare will review the form and will approve it, and sometimes the approval is indefinite.
okay.
So there you go. Like, you will be saving a lot of
Mm.
money if the special authority is in place.
पण
Some
म्हणजे आपल्याला माहिती हवं, की म्हणजे समटाईम्स यू सेड की काही लोकांना माहितीच नव्हतं, की स्पेशल ऑथरायझेशन असं काही असतं. राइट?
Absolutely. And that's,
हं,
if you're aware, then you can question your pharmacist. You
हं,
can
हं,
ask, oh, why this medication is not covered for me? All other medications are covered for me, right?
हं,
Then the pharmacist may tell that, oh, it requires a special authority. Most healthcare professional, most pharmacists are very good. Okay, they will educate clients, right?
हं,
But sometimes if they are busy, they may not tell. So it's good idea you to be aware of all this, so you can ask the right question. Or you can even call your extended healthcare and ask, oh, this medication is not covered for me, is there any way it can be covered, is there
हं.
any process involved, right?
ओके.
And then they can discuss that with their physician or the pharmacist, and both of them might help to get this medication covered if they're eligible, right? So it's
व्हेरी, व्हेरी हेल्पफुल इन्फॉर्मेशन.
Thank you. Yeah, and I'm sure a lot of a lot of people connected here. If they are not
हं,
aware, they can question their pharmacist, or
हं.
they can question their physician, like, oh, is there any way they can help in getting this special approval for the medication?
बरोबर. अच्छा, तर आणि एक आहे असं, की आता तुमचं हे म्हणजे आपण म्हणतो, की फार्मसिस्टचं मेन जे जॉब किंवा काम आहे, ते म्हणजे मेडिकेशन डिस्पेन्स करणं. तर
Yeah.
आपल्या इथे कॅनडामध्ये ते सोडूनही बरेच सर्व्हिसेस आपल्याला फार्मसीज देतात. तर त्याबद्दल तू सांगशील का? काय-काय सर्व्हिसेस देतात आपल्याला इथे?
Ab- Absolutely. Um, Pallavi, right now, pharmacy profession is changing a lot. A lot of new services are coming. A lot of these services will help client. The goal of government, the goal of healthcare professional is to ensure that client gets the best care, right?
हं,
And those services, a lot of pharmacies they offer. Some are through pharmacare, through government. Some are independently run by the pharmacies, community pharmacies, right? Let me share some of the services which are covered under the pharmacare program, uh, and some pharmacies they take care of it themselves, right?
हं,
So let me give you a little bit of information about some of the services like medication reviews and care plans. Uh,
हं.
do you have any question? Like, we discussed about this a little bit before about medication reviews and care plans, or should I just
या यू
continue?
यू जस्ट या स्टार्ट सेइंग दैट टॉकिंग देन मी म्हणजे जर का आले प्रश्न मनात तर मी विचारू शकते तुला,
Okay,
राइट?
sounds good. Okay, perfect. The medication reviews and care plan is basically one of the publicly funded program of Pharmacare, and what it is twice a year. pharmacists are allowed to meet with client to review their medications and prepare best possible medication history. Now, this actually, let me tell you my history. This program came in effect quite few years, but before that, back in 2014, before the program even roll out, or 2013 or 14, I was one of the pharmacists. One of the we have. I used to work for medicine shop. One of the pharmacy picked by Ministry of Health and British Columbia Pharmacy Association to roll out this project. It was called Medication Management Project.
Hmm.
And what that project was about: meeting the client, okay, reviewing client's medication, asking them questions how they are taking medications, if they are experiencing any side effects. And the outcome of that project was amazing. You know, minor changes in the client's medication profile, or just a regimen, has made a huge difference in their life.
संतोष, जरा मोठ्याने बोलावं लागेल तुला. आता असा
Sure.
मेसेज आलाय, की त्यांना नीट असं पूर्णपणे ऐकू येत नाहीये. त्यामुळे थोडं मोठ्याने बोल. हं.
Absolutely. Okay. So the medication review is basically, it's what we do is we meet a client in the pharmacy, okay, and we go over with their medications and prepare a best possible medication history. Okay, let me show you one quick example of how it looks. Okay, so as I said, pharmacists are allowed twice a year officially to go over with clients' medication and prepare the best possible medication history. It covers the patient information, their name, PHN number, date of birth, phone number, then family physician, phone number, fax number, any allergies they have, any medical conditions they have. And then what we do is we go over with all their medications, prescription medications and non-prescription medication. We check the interaction between all of them as well, most of the time. And what we do is then we make the list of what medications they are taking, why they are taking those medications, how they are taking those medications, and any special instructions with those. Now, while interacting with them, sometimes we realize that, either client is taking the medication differently than they're supposed to take sometime, right? Or they are not taking some basic precautions. That's why they are experiencing some side effects. For example, I'll tell you one of the popular medication, atorvastatin. Lipitor is a brand name. It's used for high cholesterol. And one of the special instructions we give the client is do not take grapefruit or a grapefruit juice with this medication, because grapefruit and Lipitor, they interact, atorvastatin interact, and sometimes the interaction could be fatal. Okay, it may lead to even a kidney damage, right? So depending on their dose situation, right? So just simple instructions that do not take grapefruit or a grapefruit juice with this medication will avoid this problem. Or, my experience, like I was talking about the medication management program, or the project which we did with Ministry of Health and BCPHA. While I was interviewing some clients, a simple thing, like, when I was asking a client, they were taking a medication for hypothyroidism, okay, a very popular brand, Synthroid, okay, and I was asking them, how are you taking this medication? So the client said, oh, sometime I take in the morning, sometime I take in the evening, okay, sometime I take with my multivitamin. And then I realized, because when he was experiencing, when he was sharing with me the symptoms, I was a bit confused, because some of the symptoms were of hypothyroidism and some were of hyperthyroidism. And then there were frequent changes in his dose happened previously. So I was curious to know, like, what happens, like, for example, if the dose is increasing, then it's a different thing. But sometimes the dose is increasing, sometimes the dose is decreasing. So it
हं.
could be that they may not be taking it properly. So the simple solution which I suggested them is to take the medication same time every day on empty stomach with lots of water, and do not take any other medication with thyroid medication, especially if they are taking multivitamins or any other medication which will interact or it will block the absorption of the synthroid, right? So simple change like that, just space it out by 2 hours, okay, or 4 hours, that will help with getting the appropriate dose to the body, and they may not experience those symptoms, right?
मला वाटतं, की हे रिव्ह्यू करणं प्रत्येकाला फार गरजेचं आहे. कारण आता ह्या कोव्हिडमध्ये बरेच जण सप्लिमेंट्स घेतात. बरेच सप्लिमेंट्स वेगवेगळे घेतात. सी घेतात, झिंक घेतात, बऱ्याच गोष्टी घेतात. तर
Yes.
कधी-कधी माहिती नसतं, की कुठच्या मेडिकेशनमुळे काय आपले जर प्रिस्क्राईब ड्रग्ज असतील कुठचे, तर त्याच्याबरोबर घ्यावं की नाही घ्यावं. तर त्यांनी येऊन अगोदर रिव्ह्यू करावा, नाही का? फार्मासिस्ट बरोबर.
Absolutely, absolutely. And the good thing is, pharmacist or database,
हं,
has it can check interactions like for prescription medication, lot of non-prescription medication. It may not include all, but lot of non-prescription medications are also included. And after we check the interaction, it will tell us okay
हं,
what medications are interacting with what,
हं.
and it'll even tell us like how you can resolve it, right? That's the beauty, if required, then we can even inform client that you need to talk to your physician, or I can talk to your physician, that there's a interaction, and because of this interaction, whatever the side effects you are experiencing, that is causing more problem, so
हं.
it need to be resolved, right?
राइट.
uh,
थोडासा आवाज अजून मोठा करा तुझा स्वतःचा बोलण्याचा. थोडासा.
okay,
हां.
sure.
हं.
Okay, so can you hear me now?
हां. मला
Is it
तर
better?
ऐकू येतंय, पण काही जण म्हणतायत, की त्यांना पूर्णपणे नाही ऐकू येतंय. हं. थोडं जवळ येऊन बोललास तरी चालेल.
Okay, sure. Okay.
म्हणजे
Okay.
मग आता हे तू जर रिव्ह्यूचं म्हणलास, तर ते सगळी फ्री सर्व्हिस आहे फ्रॉम फार्मसी, राइट?
Yes. It is a free
एव्हरी 6
service.
मंथ्स वी कॅन गो एंड रिव्ह्यू आवर मेडिकेशन.
Absolutely. Especially, if you're taking more medications, if you're taking more supplements,
हं,
it's a good idea to review. It doesn't matter whether you're taking like one or two prescription medications,
हं,
and other supplements, right?
हं, हं.
So it will definitely help you to make a right decision. Our goal is to, whatever we are taking, it should not lead to something else,
बरोबर,
right?
बरोबर.
And if you are aware, then you can make right decision, right choices, right? And the good thing is, when we make those the list, we print out, we give the list to the client, then the client should always keep this list with them wherever they go to see healthcare professional,
हं.
or if they are traveling, especially if they're traveling out of province, out of country, it's good idea to have that with them. If they have to see a physician there, right, they would know what medication you're taking, right, and for what you are taking those medications for.
हं.
um, Sometime, out of province or out of country, the brand name of the medication may be different, but the content may be same, and there might be a duplication of medication, or the new medication they are planning to prescribe may interact with the existing medication, right?
हं.
Sometimes we cannot remember all our medications top of our head, right? So it's good idea to carry those medications
हं.
when you're traveling also. Like, say for example, if you have that medication in best possible medication history record, at airport also, if you have medication, if they question, you can show that, yes, this is my pharmacy, this is my doctor, and this is the list of medication I have, and this is what I use it for, right? I mean, it's good to have that. It will help other healthcare professional to make better decision. Does it make sense, Pallavi?
फॉरगेटफुलनेस बद्दल आपण म्हणलो, तू बोललास तर ते तसं आहेच, की लोकं विसरू शकतात. ते तसं लोकं विसरतात औषधं घ्यायला. तर
Yes.
त्याच्यासाठी पण तुम्ही सर्व्हिस देता, राइट?
Absolutely. And then what we do in a situation, like, sometime we even make a care plans also along with a medication review. So I'll tell you what is care plan about, right? So care plan is basically we make a short term and a long term healthcare, what is clients short term and long term healthcare needs and therapy goals. Like say for example, if the client is taking medication for diabetes, so we tell them like, what's your short term goal? Monitor your blood glucose regularly. This should be your target, like before meal this should be your target level. 1 to 2 hours after meal this should be your target level. And what you need to look for, right? So when we make goals and if we work on that, it helps to keep our medical condition in check, right? Also, if you are on your target, your there is a chance that your physician may reduce the dose of your medication, or if things are back in track based on the situation, your physician may even discontinue the medication, right? Because you're working towards your goal. Sometime uh, for example, if you're taking medication for high cholesterol, we always recommend clients that lifestyle changes are very important along with the medication for high cholesterol medications.
Mm.
Simple changes to diet, to exercise, like, it really helps, right? And, down the road, if your lab work numbers are within normal range or on a lower side, doctor will think about reducing the dose. That should be our goal, basically. Like,
Mm.
even though we are in a pharmacy profession, we always advise our client, um, take care of your health. Okay, minimal medication is the best, right? If we need it, definitely, you need it, but
Mm.
at least somewhere work on your goals.
बरोबर.
Okay.
तर मग आपण आता बोलत होतो, की जर माणसं विसरायला लागली त्यांचं मेडिकेशन,
Yes.
तर तुम्ही काय सर्व्हिसेस देता त्यांच्यासाठी, की सकाळचं विसरले संध्याकाळी घेतलं किंवा विसरूनच गेले, तर कसं काय ते करणं शक्य आहे?
Absolutely. And this is very common thing. It happens with everyone. Like it happens with, you must have experience as well. Like sometime we get even a prescription for 10 days. Okay. And the prescription says, and take antibiotic, for example, for 10 days, one tablet 4 times a day. Okay. And for 10 days. And we forget sometime dose, right? But if in 10 days if we forget one or two or four or five doses, right, it is possible that those who are taking medication like 3, 4, 5, 6 medications, it is possible that they may forget the medications, or they may double dose or overdose themselves,
हं,
right? So whenever we come across situations like that, where the client is taking more medications, and if we see that, they are not compliant. Compliant means, for example, say somebody filled the prescription 3 months supply, uh, say for example 6 months ago, and they're coming to the pharmacy now to fill the prescriptions. So what it means, it tells us that they have used that 3 months supply probably for 6 months. It means that either they're missing the doses in between, right? Or they're sometime ignoring taking it, feeling that, oh, I think my blood pressure is okay now. Okay,
हं,
so I'm going to skip it today, right?
हं,
That happens. And oftentimes, we get a request from hospitals, from their physicians, that please request this client to be on a blister pack. Sometimes the hospitals, when they discharge, they will specifically say that we want this client to be on a blister pack, okay, because they are not compliant, right? So in the situations like that, what we do is basically blister pack or a compliance packaging is organizing all your prescription medications, vitamins, supplement, all non-prescription medication also in one place. And the beauty of that, like say for example, I'll show you one of the blister pack, which we prepare in a pharmacy. Just a second, I jumped on the next slide. So you
हं.
can see here, that's how the blister pack look like. Like it is from Monday to Sunday. 7 days blister pack. You can make it a monthly blister packs. You can make it more as well. So it's says morning, noon, evening, bedtime dose. Say for example, Monday morning. Okay, if I have to take the medications, all I do, if it is organized in a blister pack, I just press it from the top. The medications come from the bottom, right? You take all your medication, that ensures that you have taken the medication. That's first. Second, if you forgot to take the medication will stay right there. So it's a reminder for you. Oh, I forgot to take the medication. Let me take it as soon as possible, right? And you know, if you are compliant, the chances that there will be more medication added will reduce substantially. Second, it may happen that if you're compliant and if your lab numbers are good, if you everything is well monitored, your physician may reduce the dose or even discontinue the medication, right? So that's the beauty of blister pack. We definitely recommend clients who's taking multiple medication to put that in a blister pack. Or some client, like I have a client who takes only one medication, who has Alzheimer. So she forget taking that one medication also, right? So we put that in a blister pack that tells them that you know uh, to take the medication, and the family members can check it as well. Say for
बरोबर.
example, if you've taken the medication, it will not stay there. If you
हं.
haven't taken it, then it's a reminder that please take the medication. Sometimes it's annoying for some client. They feel that, oh, why are you asking me, have I taken the medication or not, right? But by looking at this, it's just a friendly reminder that
हं.
yes, you have to take the medication, right? And it really really helps. And most pharmacies offer this service, free service of
हं.
blister packing, right?
हं.
And
पण मग
a
ते
lot of
कोणीही
them.
जाऊन ऑर्डर करू शकतं. म्हणजे उद्या मला वाटलं तर मी सांगू शकते फार्मसिस्टला, की मला करून हवंय ब्लिस्टर पॅक.
Absolutely, absolutely. Um, you know, in most situation, it's a pharmacist who can make the decision, right?
हं.
And we have to notify physician as well in certain situation that the
ओके.
client is taking blister pack, so they are aware as well. They appreciate that a lot of time. Also, say for example, if it is only over the counter medications and you
हं.
want to blister pack those, right?
हं.
The pharmacy may charge a minimal fee to
हं.
blister pack because it's their time involved to
हं.
make that, right? But if you're taking 4 or
प्रिस्क्रिप्शन.
5 medications from the same pharmacy, then they offer a lot of those. They offer this service free. Some of them, if they have an extra high need and they are monitored as well, sometimes they are on a weekly blister pack, and then we make a delivery also to make it more compliant as well.
मला दुसरं विचारायचं होतं, की तुमचं ते होम मॉनिटरिंग प्रोग्राम पण आहे. म्हणजे जे लोकं मेंटल हेल्थ प्रॉब्लेम आहे किंवा जे एकटे राहतात आणि ते विसरत राहतात, त्यांना तुम्ही घरी जाऊन पण सगळ्या सर्व्हिसेस देता, राइट?
Yes, yes, absolutely. That is something. Again, the service which is not actually all pharmacies across BC they offer. Only some pharmacies, okay, they give those services. Okay, and we are one of the pharmacies. All our location, 3 locations, we offer these services. And let me bring up that slide. Let me show you. Uh, how that program is run. Okay, so there it is. So this home medication monitoring program is for clients who needs extra care and support, especially if they have multiple medical conditions or they're taking multiple medications. Oftentimes, if they are forgetting medications or they are frequently hospitalized, right? A lot of time hospital will get in touch with us if we are offering these services. They will request pharmacy that this client is hospitalized more often, and the medication, uh, they're not taking it regularly, they're missing it, overdosing it, or sometime they have a medical condition which needs that attention, like they have dementia, or a very senior client, they can't take it, they need some support. or they're taking medication, multiple medication for diabetes, or they're taking insulin, they're not taking it regularly. So then our nurses come into a picture. We have LPN on our board, and those LPNs, what they do is they visit the client and they witness the dose. They will
Mm.
give the dose, and they will check the blood pressure and blood glucose if required. Also, for some clients, for example, clients taking a medication for mood disorder or psychiatric conditions, then our nurses, they even give injections if the physician authorizes. Like those injections are given every 4 weeks, and that just ensures that their condition is well monitored. And sometimes we get a call from mental health, like Surrey Mental Health or Burnaby Mental Health or White Rock Mental Health, and the case managers, they tell us that, oh, are you offering this service? We have a client here who needs those services, right? And then we offer these services. Some of those services are covered by Pharmacare, especially if their deductible is very low. The Pharmacare pays for the cost of medications and the services which we offer, basically, or
Mm.
we just have make sure that those services are a part of it, and we the nurses, they monitor the medical conditions as well of the client, and if there is any question, concern, they will address it to us, and then we address it to a physician. Also, once in a while, then physician will get in touch with us, will ask a record for blood pressures, for blood glucose, if they have to adjust the dose or insulin doses need to be adjusted. Then we share that data with them, and they accordingly take the decision.
सो हा सगळा प्रोग्राम तुमच्या फार्मसी चालवते, म्हणजे फार्मसीचा आहे. इट इज नॉट गव्हर्नमेंट प्रोग्राम.
It's not a government project. It's
हं,
a pharmacy offer these services,
हं,
and there is a need. We realize that some of the pharmacies in Lower Mainland, they initiated that program. Earlier, where I used to work in medicine shop, we used to run this program, and I realized the value of it. So we
हं.
bring that to our pharmacies, and sometimes the hospitals, they request, especially. Let me share one example with you. I have a client who was hospitalized for health condition, for heart condition, and the cost of keeping that client in the hospital, everyday cost was $1,500. So sometime hospitals, they say that it's too much for them to actually take care of that, and if it can be monitored by the community pharmacy properly, right, and the client is stable now, can be discharged, but they want to make sure that because of negligence, because they are not taking medications regularly, they don't want them to be hospitalized again, right, just to avoid that, and just to improve their quality of life, their health, they request sometime those services.
आता आपल्याला समजा स्वतःला वाटलं, की मला ह्या सर्व्हिसची गरज आहे. तर
Yeah.
मग येऊन आपल्या फार्मसीला सांगावं आणि दे मे चार्ज यू राइट इफ यू डिसाइड टू हॅव दॅट प्रोग्राम.
No. So the way it goes is, if you express that to a pharmacist, if you
हं,
tell, it could be your friends, families who might need these services. If you see them, they're struggling with their medication, they're
हं,
struggling with their health, right?
हं, हं,
And you think that, there is a need for this extra help and care, right?
हं,
So you can share that with a pharmacy,
हं,
especially those pharmacies who are offering those services, and
हं,
they can express that to their physician, that there's a need for this kind of service to this client. Are you on board? Would you like to initiate? Would you like to have a conversation with this client? And
हं,
then they will make a decision whether
हं.
it is appropriate. Obviously, this program has to be approved by the doctor. The
हो,
doctor has to see there is a need for
हो.
that, because we don't want to unnecessarily increase the cost of anything
हं,
if there is no need, right?
बरं.
It's only if they need it,
हं,
right?
हं,
And as I said, different people have different needs, and we
हं.
don't know when they will need this kind of services. So it's good idea you can share with those who need those services. Or if we identify those clients, then we can initiate also ourselves, we can share with them.
ओके. आणि तू म्हटलं होतंस की तुमच्या इथे कस्टम कंपाउंडिंग लॅब तुझ्या ह्याच्यामध्ये आहे.
Yeah.
तर त्याच्याबद्दल तू सांगू शकशील का त्याचं
Yes,
काय
of course.
महत्व आहे?
Yeah. Okay. Okay, let me share what is custom compounding. Custom compounding is basically, there are some, medications which are not commercially available. Okay. And those need to be prepared in pharmacy in-house. Okay. Like say, for example, very common is pain management creams. A lot of people, I'm sure, must have used diclofenac 10%, 15% pain management cream. We are specialized in making that. We have a compounding lab in Burnaby, and we do a compounding in Surrey as well, our Surrey location. And what we do is we get a prescription from a physician, and we compound those prescription. It's either in a cream form or a gel form, and that really helps to reduce the inflammation, right? It really helps with their day-to-day activities, especially knee pain. If you have that, it's hard to function, right? And you need some medications which are locally effective. Sometimes if you are taking medication orally, you may experience side effect, right? Like say, for example, if somebody has ulcer and if you are taking anti-inflammatory medication more often, that might aggravate the ulcer, right? Or if you're taking anti-inflammatory orally for a longer time, okay, it could even cause the side effect, and it might lead to ulcer as well if you're taking it for a longer time, right? So in that situation, we even sometimes recommend clients that you can probably try this, or the doctors oftentimes they recommend, and then once we get a prescription, we prepare it. We also prepare some skincare formulations for eczema, for psoriasis. Oftentimes, skincare specialist, they will get in touch with pharmacy. They will say that I would like to prescribe this compound to the client, right, in a proper base. So based on the information, we prepare the compound and we dispense that. We tell them how to use it, how to store it. So yeah, it really helps. I've seen client like psoriasis all over the body, so it's very difficult sometimes to function. So we compound those. It really helps them to manage their medical condition, right? And there are some difficult compounds also. We do progesterone, like hormonal creams, especially after menopause. A lot of women, they require those cream. It helps with the symptoms they are experiencing. We also prepare like really strong pain management creams as well. Some are quite expensive, some are even covered by WCB, like if it is injury from the workplace, right? So it really helps them with that, right?
कस्टम कंपाउंडेड क्रीम्स जे आहेत ते आपण आपल्या फिजिशियनला जाऊन सांगू शकतो का की आम्हाला नाही बरं होते, तर तुम्ही काहीतरी असं द्या की जे
Of course, yeah. And that's a good thing. Like, if you're aware that there's something available like this, then you can request your physician, oh, can we try this? Right? Sometimes, the physician's intentions are very good, but sometimes they may not think that, oh, maybe a compounded cream might help them, right? Some compounds are very easy, just a mixing of two creams or ointment, right? Some compounds are difficult. Sometimes for some compounds, we may have to request client to pick up next day, because we have to make it, stabilize it, and then they have to pick up next day. Yeah.
चला, तर आता आपण ना आता हल्लीच्या अगदी हॉट टॉपिक कडे बघूयात.
Sure.
सध्या वॅक्सिनेशन हा शब्द सगळ्यांच्या मनात सतत घोळतोय. तर थोड्या दिवसापूर्वीच मी न्यूजवर ऐकलं होतं की ओंटारिओमध्ये फार्मासिस्टना कोविड वॅक्सिन डिस्पेन्स करायची परमिशन मिळाली. तर मला 2 प्रश्न तुला विचारायचे आहेत. एक म्हणजे BC मध्ये असा सुवर्ण दिन कधी येईल? आणि दुसरा असा की आपल्याला नेहमी लोक जाऊन फ्लू शॉट्स वगैरे घेतात फार्मसिस्टकडे, ते माहिती आहे. पण असे अजून काय किती व्हॅक्सिन्स आहेत जे आपण फार्मसीकडे जाऊन घेऊ शकतो विथआऊट गोइंग टू फिजिशियन्स आणि आर दे कव्हर्ड बाय एम-एस-पी किंवा फार्माकेअर किंवा कसं काय त्याचं आहे म्हणजे की यू हॅव टू पे फॉर सर्टन व्हॅक्सिनेशन्स. कारण काही नवीन आलेल्या लोकांना ह्याची इन्फॉर्मेशन फार बेनिफिशियल होईल, नाही का?
Of course, of course. Flu shot is very popular now
हं,
in pharmacies. Rather, the new statistics is more than 70% of the flu shots in Canada are given by pharmacists now.
हं,
One good reason is a lot of physicians, they are the one sometimes requesting get it from your pharmacy. Second, um, uh, sometimes it's difficult for you to get the family physician's appointment. If they
हं,
are fully booked, they may be available after 2 weeks. Then, local pharmacies are sometimes easy to get into. A lot of time they will allow you and walk-in clients to get the flu shot, or you can phone your pharmacy or the nearby pharmacy and you can make appointment and you can get the flu injection,
हं,
right? And it's very popular. Most pharmacies, they are experienced and they have a authority to give injection. It is very important that you can check with the like, are you authorized to give injection? Like, there nobody will give without the authority, right? But we have to go through a training process,
हं,
ensure that we are ready to give injection. Beside flu shot, very common is pneumonia vaccine,
हं,
tetanus shot, shingles vaccine, and some travel vaccination like hepatitis A, hepatitis B, especially, say, for example, if you're traveling to India,
हं,
then recommended is hepatitis A is recommended, typhoid vaccine is recommended, and those you don't have to actually see travel clinic, or you don't have to see a physician for that. A
हं,
pharmacist can give as well.
हं.
Certain shots, vaccines are covered by government, like, say, for example, flu shot is covered, tetanus is covered, pneumonia like pneumovax 23 is covered. Prevnar is another kind of shot for
निमोनिया
pneumonia.
सगळ्यांनाच कव्हर्ड आहे की आफ्टर सर्टन एज कव्हर्ड आहे?
Tetanus is covered
नाही
uh,
निमोनिया,
all the time,
निमोनिया.
all the time.
निमोनिया.
Pneumonia is covered as well.
हो
So
का?
pneumovax 23 is uh, it's recommended for clients, especially we recommend over 65, and it's very, very important to take that. It's recommended every 5 years. Okay, it's free and you
कुठली
can consult
सिंगल्स
with your
म्हणतोय का तो?
physician. Sorry.
सिंगल्सचा म्हणतोय का?
uh, Pneumonia.
अच्छा,
And shingles is definitely shingles is recommended for everyone after certain age, right? And shingles is not covered by Pharmacare. It is unfortunately, maybe in future Pharmacare may cover for shingles vaccine, right? But your family physician is the one who will prescribe that, and then either he can give or the pharmacy can give. Usually, because shingles is not covered by Pharmacare, most pharmacies may charge $10 for giving the shingles vaccine.
ओके.
If you are regular with some pharmacies, they may waive that charges
हं,
depending on the pharmacy. Some pharmacies, like, they charge a little bit more, right? But it's not that, it's just your time saving as well, especially if you have to wait for physicians to inject you after a certain time, right? um, Now the next is a very important and a very hot topic, as you said, is the COVID vaccine.
हं,
So the good thing is, BC is now working on it. Right now, they have started with seniors, and they have started with all the healthcare professionals. I got my first shot just last week. I got a Pfizer vaccine,
हं.
and so far it's good. And the second shot is recommended after 4 months. Now, as you rightly said, Ontario and Alberta, they are planning to roll out COVID vaccines through pharmacy as early as, I think Alberta is trying end of this month, or could be early in April, right? And I'm hoping that BC will start that probably sometime in the month of April or early May. depending on how many doses they will get it and how the planning is. But because they know that pharmacists are very good in doing this, right? So they will probably seek the help from pharmacists, and probably obviously the physicians as well, to roll out this. I'm positive that for a general population, like when it comes to under 50, they will be definitely going through pharmacies, because it's going to be hard for health authorities to really take care of that many people, right? Whereas it'll be easy for them to walk into the pharmacy close by. They don't have to miss the work, right? And they can get the injection right there, right? So let's hope that we get it soon, and then you're most welcome to our pharmacies or the pharmacies where you go usually.
सगळ्यांचे नंबर तुझ्याकडे लागतील, बरोबर आहे. तर दुसरं आपण बोललो होतो की अडॅप्टेशन ऑफ प्रिस्क्रिप्शन, राईट? की सगळेच तुम्हाला जर रिफिल करायचे असतील प्रिस्क्रिप्शन, यू डोंट हॅव टू गो टू फिजिशियन ऑलवेज. तर कुठच्या सिनारिओ मध्ये तुम्ही जाऊ शकता फार्मसीकडे की फार्मसिस्टकडे आणि आपलं रिफिल करू शकतो? कधी कधी जाऊ शकतो? ऑलवेज जाऊ शकतो?
Yeah, it's a very good question Pallavi asked, and a lot of people probably don't know about it, right? What is adaptation of the prescription? So adaptation is basically, what we do is, sometime when the client is taking prescriptions. Okay, let me go to that appropriate slide. Just a second. Let me bring it up. Okay, so here it is. Okay, so what pharmacists take the responsibility to make a change to your current prescription if it is appropriate. Like say, for example, there is a dosage change, okay? And when we check with the client, and that client says, no, my dose should be same as before, right? I am very positive, right? So I'm traveling right now, or you can say that, I need exactly how it is, right? Then we can, for certain medications, we are allowed to adapt the prescription, and we have to notify the client that we have adapted the prescription. Client said that we need those prescriptions, and then we adapted and we have notified the client, right? So that is that's we are allowed. Second is, we are allowed.
एक minute, you notify the client or you notify the
Oh,
physician?
sorry. We notify the physician, okay, to that we adapted the prescription, right? Sometimes we do a therapeutic substitution also. So what it means, for example, a client is taking for hyperacidity or acid reflux, okay? Very popular brand. Say, for example, they are taking pantoprazole, okay, Tecta, right? And in the past, they tried rabeprazole. And they're saying now that, you know what, rabeprazole worked really well in my situation. The pantoprazole is not working well, right? Can I change it to rabeprazole, right? So then we are allowed to make that change. After we make that change, we ensure that the doctor is aware of it. So we fax them the information. If the doctor has any question or concern, then they will either fax us back, or they will call us saying that this is the reason I changed the medication. Then we notify the client, right? And for extending the prescription, which is very common in adaptation, especially, the patient comes, oh, I'm out of medication. I don't have many medication left right now. I cannot see my family physician. He's either on vacation, or I am not getting appointment right now. Would you please give me emergency supply? Or, would you please adapt my prescription? Okay, would you extend it for 3 months? I can see physician for next month or couple months, right? So in certain situations, and for certain medications and medical conditions, if we know that, the client is stable on the medication, their medical condition is well monitored, their numbers are okay, if we feel comfortable, then we extend that prescription for another 3 months. and then we notify a physician that we extended this prescription for 3 months. The client is doing okay, and we take the responsibility for that, right? But if only in certain situations it's allowed, right? If it is not within our scope of practice, then we will inform client that it's not within my scope of practice, right? I can probably give you an emergency supply for a few days if it is feasible, if it is allowed. Like certain medication, for example, narcotic medication, we're not allowed to give emergency supply unless the situation is very different. You know what I mean, right? So usually all we do is within scope of our practice and make sure that we follow all rules and regulations.
Okay. But it's worth going to a pharmacist and ask.
Of
जर
course, yeah.
तुम्हाला मिळत नसेल डॉक्टरची अपॉइंटमेंट किंवा डॉक्टर नसेल
Absolutely. Yeah.
तुमचं
And especially if you have to travel, emergency, you have to travel, you cannot see the physician and you need that medication. You don't want to take a chance of getting it somewhere else. You're not sure about it. You're stable right now. Then your physician, your pharmacist can help you. And in certain situation, the pharmacist, even if you're going to, say, for example, my pharmacy, and now tomorrow morning is your flight. Okay, you can go to a pharmacy which is open late also. You can request pharmacist, can you give me emergency supply just for a time being until it covers your that emergency situation. Could be 2 weeks, could be 3 weeks, right? Based on then the situation, the pharmacist will make a decision and will say yes or no. But in most situations they are very helpful. Like a lot of pharmacies, they're very good, they're very caring, right? And they really help in these situations.
तर आता असं सांग, की काय नवीन-नवीन चेंजेस आता येतायत किंवा आलेत सध्या? तर ते आपल्याला माहिती करून घ्यायला.
Sure. So, there are a lot of new changes are coming. So, among the upcoming changes is soon Pharmacare or the government will be allowing um, some pharmacies
हं.
to pharmacists to prescribe certain medications, like for some common conditions. Like, it's all depending on the pharmacist's experience, their knowledge, right? They can assess the situation, they will diagnose it if required, and they will prescribe the medication. But these changes are not yet in effect. It's in effect in Alberta. Albertan pharmacists, they are taking care of some minor issues, like, and they will prescribe certain medications. Like, say, for example, a client has, inflammation, and they have tried some medication in the past, it worked, right? The situation is same. We talk to them. If everything looks good, we can probably give a short term dose to them, right? And then we will take a responsibility for that based on the situation. Also, there will be a lot of new things are coming, especially access to e-health. The pharmacy will have eventually the access to the lab data, right? Sometime, the dosing adjustments are required. Like, in the just a few minutes ago, I told that some clients are taking warfarin and they need to monitor their dose. They have to do INR, and based on INR, the physician, they adjust the dose. But in future, pharmacy, if they are qualified enough, they are experienced, they know what they're doing, then they may even adjust the dose as well. In certain provinces, it's allowed, right? But it all depends on the situation. Or say, for example, if if the lab data says the blood glucose number is very high, right, or their HbA1c is high, right, at least we can notify the client that, your HbA1c number is high. Most of the time physician will get in touch, right? But we can actually intervene there. We can say that, this is the situation. Are you taking medications regularly? Okay, what is your goal? Are you working towards your goal? Are you making changes to your diet, lifestyle? So it will help, like, make to counsel them thoroughly, right? And also they will soon there will be access to a hospital discharge database, especially we get prescriptions from hospital. Okay. And sometimes there is a duplication of prescriptions. Sometimes there are changes to the medications, and we don't know the discharge summary, right? So at least by looking at the summary, we would know, oh, okay, this is the situation. This is the reason why the hospital has made changes. One thing I would like to share with you about the PharmaNet, I told you earlier. See, we do not have access to the changes which happens when the client goes in the hospital.
Okay.
So whatever the community pharmacies they do, we have access to that information. But whatever changes happen in the hospital, we do not have access to that, right? So sometimes our decision sometimes is decision means of the counseling may not be appropriate if you do not have that data. So I think government is working on it, so that information may be linked to us in future, so we can make better decision.
म्हणजे इन फ्युचर फार्मसिस्टला पेशंटचे बऱ्याच गोष्टी कळतील. म्हणजे लॅब वर्क कळेल, हॉस्पिटलमध्ये असताना काय त्याला मेडिकेशन झाली, काय त्याच्या प्रोसिजर झाली, ते सगळी इन्फॉर्मेशन कळू शकेल.
येस,
राईट?
ऍब्सोल्युटली. या
तर मला वाटतं आपण आता हे शेवटचं होतं आपलं.
या
तर मला असं वाटतं थोड्या वेळाने आपण आता प्रश्न उत्तरांकडे जाऊया. तर
Sure.
मंडळी, आपल्या सगळ्यांना निरोगी व दीर्घायुषी करण्यासाठी मेडिकल व पॅरामेडिकल क्षेत्रातली लोक सतत झटत असतात. त्यात फक्त समोर दिसणारे प्रोफेशनलच नाही, तर अनेक समोर न दिसणारे पॉलिसी मेकर्स, शासकीय अधिकारी आहेत. त्यांना आपण मनःपूर्वक आभार देऊ. आज संतोषनी त्याचा व्यावसायिक अनुभव व ज्ञान आपल्याबरोबर शेअर केल्याबद्दल त्याचे मनापासून आभार. या सगळ्या माहितीचा मंडळाच्या सदस्यांना नक्कीच भरपूर फायदा होणार आहे. तर थँक्स सगळ्यांकडनं संतोष. आणि आपण आता प्रश्न उत्तरांकडे वळूया.
Thank you everyone for listening to me. I would try my best to answer the questions if there are any. Thank you for patiently listening
कोणाचे
to me.
प्रश्न आहेत ते?
हो हो हो.
मग तू सांगतो कोण कोण आहे, कारण मला परत सगळं बघावं लागेल ना. कोण आहे पहिल्यांदा ते?
एक पहिला मीच घेतो आता. नंतर संतोष, तू मागे म्हटला की ते काही लिमिटेड इन्फॉर्मेशन असते फार्मसी वाल्यांकडे, पण आपण आपल्या बीसीचं जे कार्ड असतं, जे लोक फोनवर आपलं कार्ड जे असतं बीसी सर्व्हिसेस कार्ड, त्याच्यात जर मी लॉग इन केलं तर फ्रॉम डे 1 माझे सगळे प्रिस्क्रिप्शन मला दिसतात. ते असं का होतं मग?
I don't think you can access your information by yourself right now. Have you actually tried checking that, Prashant?
हो.
So you can see your prescriptions which were filled in the last few years?
हो हो हो.
I'm probably may not be aware of this then. I mean, I'll be honest with you that, okay, so when you enter, so you
बीसी
basically,
मोबाईल कार्ड असतं
yeah,
आणि आपल्या ते एक पेरिंग कोड देतं आणि मग तुम्ही लॅपटॉप वर जर लॉग इन केलं,
yeah,
इट गिव्स यू युअर ऑल मेडिकेशन हिस्ट्री फ्रॉम व्हॉट एव्हर इयर यू वॉन्ट.
that's amazing. Actually, that's amazing to know. For pharmacists, we have access to last 14 months to make the clinical decision, because that is where we need to actually know what medication they are taking. But because you can see that information yourself, that information is not available to us. It could be the reason being is we do not have to go that far, and sometimes the database will be too much for us to look into. That might slow us down. But you know what, that's amazing to know that they can see that information. Perhaps you can share with me also. To be honest, I haven't seen myself. I know that if you need the information, if you get in touch with Pharmacare, they do give that information, like all your history, like they will give you. But I didn't know that it is available right now for yourself without even talking to them. So that's amazing information, rather. Thank you for sharing with me. Something I am learning today.
याच्यात
Yeah, I mean,
सुगवेकर काकांनी
I knew that information is available. Only thing is, I didn't know that it can be even looked at right now. All these, I'll try myself as well.
रांगणेकरांचा प्रश्न होता नंतर ना, त्याच्यानंतर
हो मी काय बरं मी असं विचारत होते की फार्मानेट वरती डिस्कंटिन्यूड मेडिकेशन्स कशी काय दिसतात?
Discontinued medication समजा, for example, say if I have inactivated certain medication,
हम्म.
okay, then it will show on the pharmanet it is inactivated, okay, and then when we inactivate the prescription, we write a reason why it is inactivated. It could be a physician, they have stopped the medication. It could
Without
it could be the client said that I don't want this medication, you just discontinue it, right? So we write a message. Usually when the client says, we might inactivate it on a local system, but when the physician says that stop this medication, yeah, we can do that, and it appears on the pharmanet that it's inactivated.
नाही कारण काय माहितीये का, because you don't update that every time the patient goes for pharmacy, but I think you update every 6 months. So the discontinued medication stayed on the pharmanet.
No.
Many times.
So
No?
I didn't understand every 6 months what you're talking. Every 6 months, are you talking?
Do you update the list? When I go to the pharmacy, they ask me which medications you are on, and then they update.
Oh yes, so that is basically on Pharmanet. All your list is always there. So
Okay.
the medication review I was chatting about, it's a separate, it's not related to the Pharmanet. It's a separate
Okay.
best
Okay.
possible medication history record we generate, we create it in our software, and we input
Okay.
that information there.
Okay. Thank you.
Okay. Yes, sir.
मी विचारू का एक प्रश्न?
Yes, of course.
हा नाही मध्ये पहिल्यांदा तू म्हटला की केव्हा केव्हा आपण लाईफस्टाईल चेंज करून मेडिकेशन स्टॉप करू शकतो, बरोबर आहे? पण हा ऍडवाइस म्हणजे आता डॉक्टरने प्रिस्क्रिप्शन दिलं आणि मी संतोषकडे गेलो आणि संतोषने सांगितलं नाही तुम्ही 4 जोर बैठका जरा जास्त काढा, 1 मैल जास्त चाला, ठीक होऊन जाईल, आणि आम्ही मेडिकेशन घेतलं नाही, तर मग ते अलाउड आहे का, म्हणजे कसं काय?
Yeah. Now, see, Kaka, I mean, what I was trying to say there is lifestyle changes will help. We are not advising to stop medication. What I'm trying to say is sometimes changes to the lifestyle, changes to the diet, it helps to keep the dose same or lower the dose based on your lab work, based on the situation, and that decision is made by the physician, and they make that decision, they look at overall picture, and then they make that decision.
Okay.
Right, like there are some clients who made the changes to their lifestyle, their diet, okay, and they were on a small dose earlier, and then the physician, they looked at their data for last few months, and then they said, oh well, you know what, your numbers are so good, okay, I think whatever changes you made in your lifestyle or in your diet, it's working well, just continue doing that. We'll probably stop it for even few days and we'll see how it goes, right? And they will monitor again, and if it is appropriate, then they may stop, or if it is needed, they will start the medication again.
Okay, thank you.
Okay.
प्रशांत, मला एक प्रश्न आहे, विचारू का?
Of course.
हा, मी संजीवनी अभ्यंकर बोलतीये. जेव्हा तुम्हाला
usually what happens when they write a prescription, the brand name, okay, by Pharmacare, they allows to substitute with the generic, okay, and usually what happens, the generic are equivalent with the brand, okay. Having said that, usually the if you're taking the medication before, then the pharmacist will substitute it automatically just by looking at your profile, okay. But if it is a new medication, a lot of time pharmacists will ask you, do you want a brand name or do you want a generic name, okay. And sometimes the cost difference is huge. For example, I'll tell you one medication, atorvastatin, consider, okay. that the cost of medication for 3 months is $30, and for the brand, sometimes the cost of medication is $200, right? Now it's your choice. You really want to pay the $200, right? If you really want to, then obviously the pharmacist will dispense the brand name, right? But if you think that you're okay with the generic, because most of the time your plan will pay generic only, they will not pay brand.
या ते माझ्या बाबतीत झालं होतं, कारण मी क्रेस्टॉलवर आहे. पण त्याच्यानंतर मला एक लक्षात आलं की फार्मसिस्ट आणखीन एक इन्फॉर्मेशन देत नाही. ती म्हणजे मला एका दुसऱ्या फार्मसिस्टने सांगितलं की इनोव्ही केअर म्हणून तुम्ही तिथे तुम्ही रजिस्टर करा आणि तुमचं ब्रँड नेमचं प्राइस खूप खाली येते त्यांनी.
Absolutely. That's what I was planning to tell you right now.
Okay.
So the one thing, if you actually type in the Google drug coverage card in Canada, okay, there are two companies. One is InnoviCare and the second is RX Help. Okay, and what they do is they cover the cost difference between the generic and brand for certain molecules, right? So then you can stay on the brand name, and your plan will pay a certain portion and the drug coverage card will pay the remaining portion. We in our pharmacies, usually we educate clients about this. Okay, if they say that, okay, you know what, I want a brand name only, right? Then we say, or before we even change it, we inform them.
Yeah, but ते काही वेळेला pharmacists decide करतात whether we want generic or whether we want the brand name. आणि म्हणजे दुसरी एक फार्मासिस्ट ऐकत होती शेजारी, म्हणून मला ही इन्फॉर्मेशन मिळाली की माझं नेम ब्रँडचं औषध घेऊन सुद्धा माझी प्राइस खाली कमी राहू शकते.
Yes.
So I didn't really like that. I mean, if that ती गर्ल नसती तिथे तर मला म्हणजे नेम ब्रँड घेता नसता आला, जर डॉक्टरनी प्रिस्क्राइब केलेला.
Agree with you. And this is what happens. That's why sometimes education is important. And at the session which we had, there are some certain areas probably you may not have heard about, and then now for example, now you can question your pharmacist that I heard about this. Okay,
right.
Now sir, now since you bring this up, the other clients here, other members here, they may even ask their pharmacist, oh, can I get my name brand? Is there a drug coverage card which you can use it? I would like to have a name brand. I prefer the name brand, right?
तू दुसरं कुठलं सांगितलं? तू InnoviCare सांगितलं आणि दुसरं काय सांगितलंस?
RX Help. RX.
Okay, thank you.
Yeah, and then
संतोष,
a list of medication available.
प्रगतीचा प्रश्न होता तो, मध्ये माझा म्यूट होतं म्हणून ते राहिला. प्रगतीचा ब्लिस्टर पॅक बद्दल प्रश्न होता.
Sure. Yes, प्रगती.
ब्लिस्टर पॅक बद्दल मी विचारलं होतं, पण ऑलरेडी मला वाटतं खुशीने त्याचं उत्तर मला दिलंय की सगळेच फार्मसिस्ट चार्ज करत नाहीत. जर एक्स्ट्रा तुम्ही सांगितलं की मला आतापर्यंत लागत नव्हतं ब्लिस्टर पॅक, पण आता मला हवं आहे, तर सगळे फार्मसिस्ट चार्ज करत नाही. माझा आणखी एक प्रश्न आहे की कधी कधी फनी सिच्युएशन क्रिएट होते की माझ्या एखाद्या मेडिकेशनचा मी एखाद दुसरा डोस विसरले, कंटिन्यू केलं, समजा 30 टॅबलेट्स होत्या आणि त्या बाटलीवर लिहिलं आहे की बेस्ट बिफोर 10th of March. And now it is 11th or 12th of March. So how long should I go?
Well,
how long would it be safe?
Well, ideally, because if it says that the prescription is good until March 10, the expiry date of that is March 10, it means it's good until March 10 only.
Okay, so even accidentally, if I take it on 11th, it's not at all good.
Well, see, as a pharmacist, obviously I will say that you have to take until March 10, right? But if you take it accidentally on 11, it's not gonna make any huge difference, right? Having said that, we don't know, different people may react differently. So for me, like from a law perspective, I will always advise you to take before March 10. But from a friend's perspective, I will say that if you have taken it, it's okay, right?
Don't stress yourself.
as long as you're safe.
Yeah, thank you. And the second thing, quick, how about AstraZeneca? Now
So
One after other countries are stopping it and they are saying it's not safe. So is it really not safe? As a pharmacist, what do you think?
well, it's beyond my scope of actually our talk today. Obviously, I mean, I have a list of, it's a good question though you asked. Our association, they have created a beautiful, nice chart with all the vaccines, their dose, their, a small like common side effects, everything you have to look for. And I'll share that with Prashant and Pallavi, and they can share with all society, like everyone.
Thank you.
Yeah, yeah.
Thank you very much.
I,
I
I,
appreciate it.
I can show that if you want that, how it looks, okay, and what it
Mhm.
contains.
एक
It tells you
रसिका
about all four COVID vaccine, okay,
Mm.
their dose, okay, their duration, like, a little bit of information about each one of them.
And percentage of like how powerful it is.
Black. Sorry.
रसिका आचार्यचा
How
प्रश्न होता.
powerful it is, like percentage of it.
Yes, effectiveness. Like say for
Mm.
example, आता COVID जे आहे, Pfizer, they're saying that it's 95% effective. Okay. Um, can I show this slide? I'll just quickly show you. Okay, can everyone see?
Yes.
खूप चांगलं दिसत नाहीये ऍक्च्युली, नाही का?
Maybe I can share that with you, and you can share with everyone. So it tells about age consideration. It tells about reported efficacy. Like, for example, Pfizer, it's saying 94%. Moderna, it is 94%. AstraZeneca, it says 62%. And Johnson and Johnson, it says 66%. Okay. But for right now, the vaccine, I don't think we have much choice, right, when it comes. But the government will tell us, health authority will tell us like which one will be coming. I think for now, I think they still have Pfizer. They are getting more Pfizer vaccine, right?
And which one is the like Indian one, Maitri or something? The vaccine dose came from India.
Isn't that
ऍस्ट्राझेनेका ना?
Covishield, right?
कोवॅक्सिन
कोविवॅक्स काहीतरी ना?
कोवॅक्सिन
या त्यात मला वाटतं ऑन्टारिओ मध्ये त्यांनी चालू केलेलं आहे ते. या
महांतेशचा प्रश्न होता. महांतेश.
Hi.
Are you-
Yeah. Santosh, thank you. Thank you so
Yes.
much for the useful information. I just wanted to check if someone want to travel to India in next, say, 3 to 6 months.
Yeah.
Do you recommend any other injections apart from COVID test and vaccine?
Yes. So for India, recommended is hepatitis A. Okay. It's recommended typhoid and Ducorol. Ducorol is a oral solution. You have to take it for travelers, diarrhea, and for cholera.
Okay. Okay. Thank you so much. Yeah.
Unless I have missed someone, I don't think there is any other question that is pending.
अच्छा, मला एक कोणीतरी विचारायला सांगितलंय प्रश्न, म्हणजे एका ह्यानी. तर त्यांनी सांगितलंय की विचारलंय की जर भारतातनं जर आपले पॅरेंट्स आले
Yeah.
इथे आणि थोड्याफार अशा छोट्या मोठ्या गोष्टीच्याकडे डॉक्टरकडे नाही गेले, पण त्यांना काही मेडिकेशन घ्यायचंय, तर ते काय अशी गोष्ट आहे का की कुठून काही असा प्रोग्राम आहेत का जिथे त्यांना कमी चार्ज पडेल वगैरे, असं काही आहे का?
See, if it is a prescription medication, then we are not allowed to dispense anything without prescription. If it is a prescription medication.
प्रिस्क्रिप्शन नाही, म्हणजे आता काही पाय मुरगाळला की काही असं.
But there are lot of over the counter remedies available, right? And then pharmacists can go over. And the good thing is, if you bring in the medication the client is taking right now, right, some the family member, they can even check if it is okay to give with that medication. Like say for example, if they're taking blood thinner, okay, and then if the pharmacist give naproxen, which is anti-inflammatory, so the chances of bleeding increases right there, right? So it's very important that you share with your pharmacy or your pharmacist what medication they are taking. right? If required, they can do a quick interaction check, right? And a lot of them, they are proactive. A lot of them, and sometimes, कुठल्या पण field मध्ये, it's good idea if you know a little bit, you can ask. Always ask, then you can get some solution.
जर प्रिस्क्रिप्शन पाहिजे तर डॉक्टरला व्हिजिट करून प्रिस्क्रिप्शन आणलेलं बरं आहे.
Yes, of course.
इंडियातलं प्रिस्क्रिप्शन तुम्ही फिल करू शकत नाही.
नाही, we are not. It's not allowed. Yeah.
ठीक आहे, मग झाले का सगळे प्रश्न?
फक्त 1 मिनिट पल्लवी. पल्लवी, सर्वप्रथम संतोष, तुझे खूप खूप आभार. इतकी छान माहिती, आणि आय नो किती एफर्ट त्याच्या मागे तुमचं झालेला असेल, सगळं गोळा करून तयार करून प्रेझेंटेशन करण्याच्या मागे. मला माहिती आहे गेले 1.5-2 आठवडे पल्लवी होते हेच काम करत होती पल्लवी.
संतोषने अगदी उत्स्फूर्तपणे सगळी इन्फॉर्मेशन खुलास आपले दिल खोलून अगदी दिलेली आहे आपल्याला.
तुझी खूप मेहनत होती पल्लवी याच्या मागे.
पल्लवी इनिशिएटेड आहे असं माझ्या डोक्यात पण नव्हतं, पण आमचं जस्ट बोलणं झालं, आणि मग ऑब्विसली वाय नॉट शेअर विथ आवर कम्युनिटी, विथ आवर पीपल. जर समजा माझ्याकडून कुणाला हेल्प होत असेल, कुणाची हेल्थ बेटर होत असेल, तर नथिंग लाईक दॅट, राईट? अँड दॅट्स द मेन जॉब ऑफ हेल्थ केअर प्रोफेशनल, टू मेक शुअर दॅट द क्लायंट्स हेल्थ इज टेकन केअर.
अच्छा, आणि तू तुझे जिथे फार्मसीच त्याचा तू कॉन्टॅक्ट नंबर वगैरे देणार होतास ना, नंतर त्याची स्लाइड दाखवणार होतास ना?
येस, मी शेअर करतो. एक सेकंद. ओके. So कुणाला पिक्चर वगैरे घ्यायचा असेल तर दे कॅन टेक अ पिक्चर. Our pharmacies, they are open Monday to Friday 9 to 6. Saturdays usually between 9 and 3. And Sundays are closed. Now the services which I mentioned, those all services we offer in our all locations. We have 2 locations right now, and the third is coming soon, probably in another 3 or 4 months. It's under construction. So you're most welcome to visit us. We'll try our best to give excellent service.
चला, लवकरच आता वॅक्सिनेशन आलं की सगळे तुझ्याकडे लाईन लावणार आहेत आणि अगोदरही येतील. त्यामुळे खरंच छान इन्फॉर्मेशन सगळी मिळाली, सगळ्यांना युजफुल होईल, आणि सगळ्यांचे अतिशय आभार अटेंड केल्याबद्दल.
थँक्यू व्हेरी मच.
थँक्यू सो मच.
थँक्यू पल्लवी. थँक्यू संतोष.
Thank you, everyone. Thank you, Santosh.
बाय.
बाय बाय. गुड नाईट.
गुड नाईट.